think we have a critical mass here, meaning the moderators are all now seated and in front of us. I'm Bob McClellan. I'm one of the co-chairs of the Action Collaborative for Business Engagement, and I'm from Dartmouth. And this was a very important meeting for us. I think as an Action Collaborative, we are evolving from talking to action. And so this meeting was specifically designed around the hopes that we could crowdsource these ideas around how to actually move the ball down the field. Some of us were talking last night over dinner. We did a State of the State last year at this meeting, which was kind of both a result of interviewing thought leaders and business leaders throughout the nation, as well as looking at the literature around what was actually going on in terms of business engagement and community health. And last year we felt that things were kind of plateaued, that not much new was happening, that things hadn't really taken off from the beginnings of from the Population Health Roundtable and other publications around business engagement. But over dinner last night, we all had the impression that, geez, you know, this last year has been different. And so I'm looking forward to seeing how the conversation goes today, specifically around these ideas of action and models and the thoughts of the elevator speech, which was actually one of the first things that was asked for by our business collaborative members was, give me an elevator speech that I can take home. We started to produce it, and then we realized we didn't know enough of the content. So maybe after today we'll be able to. So the format here is I'm going to give each of you about 5 minutes to present, hopefully with this concept of some key terms that were in your realm, some actions that you felt, and if you were able to come up with a concise way of describing this in an elevator ride. So, Jonathan, I'll start with you on that side.
Okay, thank you. I'd like to say, first of all, that my group was much better than their moderator was. And I also want to thank Jody for doing a really nice job of getting all the words up. But we did begin with the key terms. And I think the first key term is public-private partnership, and recognizing that partnerships oftentimes, you know, are variable. You can have a partner who is really somebody trying to dominate you versus a partner who is really trying to understand you and meet your interests and your needs. And so that we think it's crucial to understand what kind of partnership you're forming. And we'll speak more to that on the action. In drawing partners, we think it's useful to speak to employers rather than businesses. Employers is a broader term, and it really helps you focus in on their real interests and needs, because it's oftentimes in relationships to their employees, and improving health and well-being is how they gain their benefit to that. When we talk about models, we recognize there's such variability in models in terms of not only these partnerships, but business models, and including industries, and so that you really can't define these too broadly, but you do have to pay attention to the differences in these models in order to recognize and realize how their interests can align and their needs are there. So the final was a new term for me, which was wonderful in introducing the term common vulnerabilities and exposures, or CVE, as actually a much more useful term when you're trying to bring people from business to understand the shared interests, that social determinants of health oftentimes get you into conversations you find yourself speaking to yourself and others have left the room. But if you talk to the common vulnerabilities and exposures in communities, It helps you acknowledge the history of how community has gotten to where it is, to really focusing in on the needs of different parts of the communities. So that was a wonderful term that was introduced. So then when we move to what are the actions, how do we articulate that? The first really is we need to act to convene across sectors. And it's pretty clear that no sector is capable of addressing the needs that we can recognize, the needs for better health, for well-being. And that the interests on that are such that if we can convene around a solution space, because these problems are enormously complex, and when you say, I want to invite you in to address the problem of our society, problems of our society, a lot of businesses simply are not going to see that as in their interest. But if you can identify the solution space where their interests do align, we think it can be far more powerful in convening. So with that, we also want to recognize that mapping the strengths, the different assets that different businesses bring to that, as well as the public health, the nonprofits, the government, that from there we can find the common interests and then work to identify the very specific interests. And again, if you're really working as a partner, you're as committed to helping meet the interests of your partner as you are to your own, and therefore that's what makes and defines a really good partnership. So to do that, we also recognize you have to build trust with the aligned and shared interests, and we're recognizing that in convening, a lot of the models are going to use an anchor institution, backbone integrators, and that is where trust building has to be crucial. So you have to, and we heard that nicely in the panels today, you have to do what you say you're going to do to build trust over time. Other things in that was identify, along with the shared interests, what are those pointed questions? What are those questions that confront us all with the need to do better? And so in our session one was, why is it that we still have maternal death rates that you only find in the poorest of countries, in our country? How is it that we've allowed that to continue? And so by finding those pointed questions that challenge everybody, along with the shared interests, we think we can make these convenings more powerful. A key part of this is that throughout, we have to make sustainability and resilience part of the multi-sector engagement. And that includes on financing, on commitments, on changes of leadership in that. And then the other key we have to get started is focus. And so I'm going to press all the elevator buttons for each floor and invite Mike Thompson to come up and speak to us about the clarity of focus.
I think you captured it, honestly. The main point here is that the danger is that we're going to boil the ocean. And I think you spoke to the common interests, the mutually supportive assets that businesses can't own it all, public health can't own it all, but there's mutually supportive assets that can be deployed, and then clear leadership that helps to drive it. So I think you hit it great there.
Thank you, Mike.
Great, thank you so much. I think we'll move on just so we have time. I think, actually, it might be helpful, Megan, for you to go next, because I think your elevator pitch will build on that. That's a good segue.
Thank you. We did come up with a really pithy elevator pitch. So thanks to the whole team that I had in the room. We were tasked with thinking through benefits, metrics, and partnerships to improve employee and community health. And we did open up with talking about definitions, but I think more than getting down to a succinct definition, we gave lots of examples of various partnerships and ones that have worked and ones that have had more challenges. But we really got down into some action items, and the first one was inviting those to the table. And we tend to invite our friends to the table, and I do this myself when I go to lunch and invite my friends that I'm comfortable with, but really moving outside of our friends and inviting others to the table where we can learn and build very different partnerships and opportunities. And you hit on trust again, and so we talked about establishing trust is vital at the beginning. And one little tidbit on this was to start small. So when we invite those to this table, don't start with this huge project in mind. Maybe start with something we like to do at General Mills, which is pilot projects or a small initiative. So start small, and then align and translate values. And then we spoke a lot around a common language. So we in public health use a certain language, policy leaders use a different language, leaders in our business community use a different language. So making sure that we come to common ground on the language we choose, and maybe that language gets translated based on our audience. So it doesn't need to be all the same language, but make sure that we keep our audience in mind. And then that we agree to an agenda, and a common agenda with goals that might be short-term, mid-term, and long-term, so that we have those early successes that we heard in the early morning panel. And then we spent a lot of time on metrics and data, and this gets really tricky, but I felt like we heard some really nice areas of ways that people have worked around finding data, but data sharing can be very tricky, certainly in the health space. Certain areas the data is more proprietary and doesn't want to be shared. But someone in the group mentioned, getting down to what are we actually looking to measure, and are there ways to work around that? So you might be going after a certain metric, but as you talk as a group, it might be actually something else you're looking for, and there are ways to work around that. So those are some of our action items. We did spend some time talking about our elevator pitch, so when you go back to your respective organizations, what you can share, and our group decided on a couple of them and got really creative right there at the end. So health is at the heart of our business. # feel the pulse, which I love. The millennial in me likes the hashtag at the end. And then the second one, health and well-being is everyone's business.
Great, thank you. You actually finished 2 minutes early. You cede your time to Robin.
So our group, first of all, I just was so impressed with the individual team members and how passionate and engaged they were over their different aspects that they brought for the discussion, and I thank all of them very much, and Leslie for her faithful recording. We started out with the terms that everybody knows, and what we were thinking about was really a comment that was made right at the end of the last session, which was, let's move away from just what's important to shareholders to what's important for stakeholders. So our question was, how do you measure what's important to stakeholders? Like, how are you actually going to look at that? And we started to talk about this idea about presenteeism and how hard that really is to get a handle on. And we had some great examples from the group about projects that they've done to try to really get in touch with employee engagement, which engagement seemed to be one measure of whether they were present, whether they were using their skill set on the job, whether they felt like they were fully utilized. And interestingly, we kind of worked our way from something that I think is recognizable to some things that are a little bit less recognizable but really important. We talked about loneliness, the impact of loneliness on the bottom line of a company. And it began to feel like the company actually, you spend so much time there, right? I mean, I look around at the relationships all of you guys have here, and you spend a lot of time with each other, right? You see each other at different meetings, and you're involved in different groups. And, that is a great bit of socialness that comes to your job that you really enjoy. So when you look at people and their isolation on the job, that may be a really good indicator to you that as a company, you've got a real issue that you could really engage in pretty quickly You know, that may not be as hard to solve. We talked a lot about how you translate the experiences of the people that are working for you into an actual plan, and how engaging them in the solution is going to be so critical. And I think it really came home to me because one of the members of our team works with early child care workers. And, you know, we recognize that in a large company, man, you've got a guy in charge or a woman in charge of each of these little special projects that they can do. But when you're a company of 50 people or less, or maybe 10 or less, you're not measuring the same metrics. If your healthcare colleague doesn't come to work, well, who does that responsibility roll down to? Well, in this particular example, it rolls down to the parents. So, you know, the question was, how do you engage and make things like this really important for all different sizes of business, and who represents them and who cares about that? So it was clear that in that case, where we had talked about how important it was for companies to engage families, we all recognized that sometimes it's the families of the people that you're caring for you have to also engage. So this is a big mandate. In terms of action items, there were so many good examples that are going on, and I had said that it's just as a consumer, like I've begun to see people sharing their, AARP donated 6 million hours of volunteer time, you know, that people are beginning to talk about the amount of engagement with the community that they're actually doing as a marker of public value, and how that's translating into public value in a very consumer-facing way. And remembered, too, that the employees of a company are also consumers. There's 5 generations, as was pointed out in our group, of people working now, and they are all consumers in some way. And there's a lot of different needs that might need to be addressed there. They might address them on their own if you give them permission to do so. So in terms of action items, I think that there were a lot of takeaways on an individual basis, but a lot of it's already going on. The question is, how do we motivate companies to continue down this road about engagement? I think it's in their own best interests, honestly, and that's always, in my experience, been the biggest motivator for business. But in the end of the day, I would summarize our elevator speech as good business is good health, and it's personal.
Great, well, thanks. Perfect, 5 minutes. Yes.
All right. Make sure I get this going. Well, I'm just going to echo what the other facilitators, really lively discussion. And it was actually a very surprising discussion. I expected when I came in that we'd have a very straightforward discussion about how we can drive competition, which businesses are good at, to just, onward and upward. But actually, we started by trying to define the concept of competition, and what came out was a really frank discussion about how competition has a very dark side to it, and that maybe not everybody's totally in alignment, that, this is just this unquestionably positive force for health in our country. And that really, I think it was so good that we started with that frank discussion, because it really framed, how do we get the good side of competition and not the bad side of competition? And I won't, some examples from recent headlines were called out, I won't talk about those, but, trying to think, there's a sense that, there's a competition in the business community is a very all against all, zero sum, and maybe it's competition against society, right? Like, a lot of people feel that business is trying to squeeze money away from society, right? So it was not the positive, yay, we're all going to compete to do something great. So although there, other voices raise the fact that, of course, that is that spirit, that animating spirit that does make businesses get up and go and innovate new products, and those products do bring value, and some of them are healthier, I work in the food and beverage business, so I happen to bring up the recent oat milk revolution that's happened, right? And that's some people who they're competing, they're going out there, and it's helpful for the environment because that doesn't take as much resources, and for people who are lactose intolerant, it's all these benefits, right? So it's there are this plus and negative side, but how do we get that? Not overworking people, not trying to seem like business is trying to compete and take things from the common good, but rather contribute to the common good. So a very difficult topic. Ultimately, we are trying to frame our actions around competition. And so how could you put competition in the good light, right? How can you try to sell businesses on competing in that good way? Workforce was the first thing that went up on the board, and that's not that crazy. We even heard from some people who lead regional chambers of commerce that workforce is always what people come to get first, right? That's what their business members want, and so pretty clear there. I think everybody, there's a strong case, hopefully, that at least within this room is known for employees and how you can compete again to get the best employees and really to take your costs down for your workforce. And to manage the multiple generations, for instance, that are all in the workforce at the same time. Another thing, though, is, again, a frank discussion about transparency, and a sensation that businesses aren't necessarily always transparent, and what they're saying isn't always, there's a belief amongst the public that they're not always saying what they really believe, right? But, the flip side of that is, I put it under the broader heading of passion. There was discussion of B Corps, of brand value. Companies, especially consumer good companies, are dying for that authentic connection to people. And the flip side of this negative sentiment is actually a true way of potentially building your brand. So maybe there's something about being competitive in that space. And then there was some frank discussions about economic development. I mean, I think, the social determinants of health has been brought up a lot, and there is a renewed interest in there, and economic development is one of the key drivers of that. And the arrow goes both ways, and maybe the easier arrow, it's not a well-spoken to arrow, is that health can be a force for economic development. You can sell your community, you can sell your business on it. But it's truly, there was sort of a question about the challenge of how do you go the other way. For rural, disadvantaged communities, they need economic development. And so how do you sell from a competitive standpoint? You can't say, there's got to be some side of the business. You can't say, oh, these people, you should be able to say these people need it, but if you're going to try and find a competitive issue, something that's actually going to make you work against your competition, you need to find a way of getting business to go there and making it clear that because that's the only path we're going to get for a lot of health outcomes. So our elevator pitch was, there's a phrase I've never heard before, but it's a strategy of co-opetition. But I think it was funny because we originally wrote down, doing what you do best, right? But actually, I think that what later came out, we started to revise that as maybe what we do best, right? So if I can take that and maybe try to hack together a slogan, it's need to be moving from that zero sum what you do best, because that's what businesses think. They get excited. They're fighting to do what they do best. But you need to now you can still be competitive, but we need to think about how you can be competitive in what we do best. And how you can fight as a community, or you could think about your common interests and still compete within that to do what we do best, but getting people excited about that best part, because that is what will drive businesses, is the concept of being best. They don't like to not be best. So I would summarize. I think that's the high point.
Perfect. Thank you. And that leaves us a couple of minutes for any reflections from the audience or members of the different groups. Any thoughts about what you had just heard? Yes. Well, you need to use the microphone.
My name is Li Yang. I would like to emphasize the social goal, public policies, so which is totally different from an individual business for their profit of people, especially. And I want to emphasize the health not only is good, it's basically it's improved productivity and well-being of the general public and general population.
Okay, great, thank you.
Thank you.
So I think we are at time to move on to the next fireside chat, so let's do that right away. And at the end of this meeting, we'll talk about how we're going to take everything that you're hearing today and put it together in a way that's digestible.
Okay, just to remind us of some logistics, we will have to use our microphones when we speak, so when you do, just turn it on and off. Okay, good afternoon, everyone. I'm Kathy Bozzi. I am a member of the Population Health Roundtable, as well as serving as the board chairperson for the Michigan Health Improvement Alliance, and a member of the Business Collaborative, through which you're having this session today. So I'm especially excited about being here with my co-panelists, and it's my privilege to moderate this session. We are going to be talking about the U.S. Surgeon General's mission here on terms of community health and economic prosperity, and the pending Surgeon General's report. And we have two extraordinary people that I'd like to introduce who are deeply involved in this space and who come with an incredible lifetime wealth of knowledge and experience. So the first is Ursula Bauer, who is the Senior Advisor to the U.S. Surgeon General, and it is here to fulfill part of her mission, which is implementing the partnership strategies to advance this multi-sector work, and she has her distinguished bio in your booklet. Similarly, I'd like to introduce Greg Fairchild, who has spent his dominant career in the business sector and is currently at the Darden School of Business. He has multiple simultaneous titles and a great set of attributes and experience. So bringing sort of the health and business piece into this table, and they've come together for this work. So when just a few minutes ago, after we came back from lunch, we heard the comment that there's cause for some optimism in the evolution of this work of engaging business into this, and that certain things are happening that haven't necessarily happened before. And one of them we'll start with is the fact that the current Surgeon General has some attention on this space. I think that's the first time ever that a Surgeon General, we have the 20th Surgeon General, I don't think any prior Surgeon Generals have focused on community health and economic prosperity as a landscape issue. So I'd like to get started, and the way, just the logistics, we're going to have a bit of a dialogue amongst ourselves to get started, and then we're going to open that up to this audience for your own questions for the panel. So just to set some important foundation here, Ursula, could you share with us a little bit about what is the Surgeon General's Community Health and Economic Prosperity Initiative, and sort of why did this come to being? What was the impetus for this, and what do you really hope to accomplish by this unique effort?
Great, thanks so much, Kathy. Really delighted to be here. So the initiative, and I do sort of need to qualify that a little bit. We are a small but mighty office. We don't have staff, we don't have resources, but we do have some important tools at our disposal, and it's using those tools through which we're hoping to drive this initiative. In any case, the initiative is an effort to call attention to the relationship between community health and economic prosperity. As the Surgeon General likes to say, you can't have one without the other. And to really prod both business and public health to recognize that interrelationship. That may prompt businesses to engage in building community health, and also may prompt public health to engage in the drivers of prosperity, because of course those are also the drivers of health. So it's really an effort to raise awareness, and what we hope to accomplish is joining forces with just a whole host of initiatives and efforts in this area. We've heard from many of them today. To ignite that relationship between business and health, and to foster healthier communities and greater economic prosperity.
And associated with this work, you have the Surgeon General will produce a report, as Surgeon Generals do. And so there will be a report that we're all anticipating. And I was wondering if you could speak to what, in fact, is a Surgeon General's report, and why do we have those, and why are you producing one on this topic, and given that it's been a bit anomalous, what have been the challenges with that?
So the report is under development now. We anticipate releasing it in the summer of 2020. Surgeon General's reports are typically statements of the settled science, and from that understanding of the settled science, a way forward to solve a particular public health problem is introduced. This report is different in that we don't have a large body of settled science on the relationship between community health and economic prosperity. And specifically the importance of business engagement in that. So this report will be more prospective, if you will. It will contain exemplars and perspectives and viewpoints. It will tell the story of how these relationships have been fostered and businesses have engaged across the country. And what the opportunities are for business and health, what the meaning of business is in our society, and how we create shared value.
So in doing this, and again recognizing, as you said, this is going to be more prospective, not just the description of the settled science, so to speak. You're talking about some interesting concepts here, but what have been, as you're trying to pull this report together, the two of you, what have been the conceptual barriers to this work, and the conceptual barriers to cross-sector work that you think may need to be disabused as this idea is moving forward, as the report is coming together?
You know, the first off, probably building awareness. I think that most of my colleagues in business schools and in businesses don't talk a lot about public health. It's not a topic that we think about or talk about in our annual board meetings or in our conversations past how it might affect something that is proximal. So if there's a public health issue in the community in which our plants are located, or the community in which our businesses are located, well, we'll talk about public health. So the first is just awareness of each other. You know, I'm thinking to myself, I don't know how many of you have been in the Federal Reserve building. I'm there a lot. This is the first time I've ever been in this building. Nice to be over here. We're right beside each other, but I don't know how many opportunities the people in that building have to come in this building, and y'all have time to go over there. As an example, I think that, so the first is just awareness that we're both out there. I think I have learned so much from my colleagues in this enterprise. There's some, you know, early on as we were talking, Ursula, Bobby Milstein, he's here, some other people, Lawrence Badish is in the back, you'll hear from him later. People started talking about upstream. I was like, what are you talking about? We, in business schools and in businesses, upstream usually involves products that we create that are coming down through supply chains that would eventually be entering the marketplace. That's upstream. But I learned that upstream is a notion of a river with a baby coming down it, and just didn't know anything about any of that. Social determinants of health. So there's language that we have that are barriers. I caught the tail end of this conversation about the pros and cons of competition. I think one of the barriers we sometimes have, so I caught the tail end of that, I don't know the full base of it, is there's a fundamental either misperception or distrust that sometimes exists between the business sector and the nonprofit sector. These are tropes in my view. One of them is that business people are mercenary, interested in making lots of money, have lots of money, and care about much less other than that, don't care about much less other than that. On the corresponding side, there are business people that believe that people in nonprofits and advocacy organizations want to regulate the activities of business and want to get our money. Neither of these are true, but they're nice working tropes. I think those tropes, to the degree people believe them, influence some barriers that prevent us from working together. You know, the final thing I'd say about that is, you know, these notions that I heard the back end of. I think there are few to no CEOs running any firm I've ever been in or been with that are going to say, you know, I'm really not interested in making sure that the health of the community in which I operate would be better. I'm just interested in making some money. I've never heard anything even remotely like that. I think that most business executives are very aware of the communities in which they live. They often lay their heads in those same communities. And they actually care, but I think they're uninformed. They're unsure of what they can do or could do to be of help. That, again, is where you all come in. But if we don't talk, and our buildings are right beside each other, but we never talk to each other, then it impedes our ability to come to solutions, which is why this is such an exciting thing. One final thing, I feel like I've talked way too much. The notion of settled science relative to prospective work, I found that fascinating. I've been going to Opportunity Zones conferences just regularly these days. It's a very hot thing. Some of you may have read an articles in papers. New York Times had a nice report recently. Opportunity zones were just written into law. I go to conferences on ways we want to think about growing new markets all the time. And the basis of settled science to drive those conversations is not common at all. It's a very new initiative. And so the idea of entering new spaces to gain certainly competitive advantage is very common to business, and we think that way all the time. That was a lot, sorry, but that's what I'd open with.
Ursula, you want to address what you think might be conceptual barriers?
Sure. And I'll speak to conceptual barriers from the public health side as sort of a lifelong public healther. You know, in the last 50 years, I think public health as a discipline has maybe lost sight of the forest for the trees. our roots as community change makers really go back to the turn of the 20th century, when we were creating building codes for housing tenements, when we were designing and implementing sanitation systems, when we were really looking at system-level issues that today we might call way upstream: poverty, housing quality, quality of education. And in the more recent time in public health, we've focused on immunizations, which are very important, maternal and child health services, which are very important. But we've lost sight of the roots of public health and those root causes of the health problems that we have today: income inequality, lack of economic opportunity. So that's one conceptual barrier that I think public health needs to overcome. We don't need to stop what we're doing and start addressing poverty and lack of education, but we do need to have on our radar that those are key drivers of the health burden that we are addressing today. And we need to know who the community change makers are who work in that space, and how we can engage them and how we can support them in accomplishing their goals, because accomplishing their goals is really going to help us accomplish our goals. So I think that's critical. Greg alluded to this divide, public health, private sector. Public health is community service, and private sector is about making money and profit. And that's a pretty artificial distinction. Again, in public health, we have history working with businesses, or avoiding working with businesses that we think are contributing to some of the health problems that we're addressing. Tobacco companies are one clear example of that. But there are many more businesses, to Greg's point, that are engaged in community, that can be engaged in community, that can be partners and community change makers. So a key conceptual barrier there as well.
So given these and the upcoming report and the ongoing work, and by the way, you're not waiting for the report to carry out the work that the Surgeon General is doing, right? He's out in the community day in and day out, as are your teams. How do you think that the work that's going on today in terms of the dialogue and the report might address some of these barriers and might make a difference in that?
I think the great thing about what I think Ursula and leaders have assembled is, the opportunity for the dialogue. I think what readers will find is that this particular report, this particular project, includes not only academics, not only scientists, not only social scientists, not only people who work in advocacy organizations, but includes the voice of the corporate sector. And I think readers will find numbers of exemplars that we feature that are stories of firms that are doing things in the field right now. In other words, firms who never read a report but have decided to do the work already. And then I think people will read about business leaders, organizations like the U.S. Chamber of Commerce, that will be talking about ways that business could be thoughtful and engaged, recognizing, I guess the one thing I will caution for business readers is that oftentimes, unfortunately, because businesses often bring resources, we can be loud-voiced in terms of the way we approach the communities in which we operate. We may not always listen the way we should. And so I think one of the messages of this report as well is the existence of a dialogue. And I think, again, to Ursula and team's credit, We've assembled everything from people that are coming from what are called CDFIs, again, a type of organization very familiar to the people in the Federal Reserve. Organizations that would be typical for-profit entities, organizations that would be foundations, corporate foundations. So the collection that I think people will find when they see the report is this sense that we're doing something that's both unique in the contributions of the collected group, but also unique in understanding and trying to be thoughtful about this particular avenue of enterprise.
I'll just add quickly, so you have two perspectives at the table here, health and business. A third perspective in the report is community. So we're introducing both health and business to your community development financial institutions, your community development corporations, what I've referred to as your community change makers, who can work with both business and health in community, and who have been doing that work on their own for decades.
So I believe we're all getting an appreciation for the complexity of this and the challenge, the daunting challenge that has been taken on by the commitment to take up this report and the kinds of things that have to be addressed. I'd like both of you to speak to, and you talked about the messages and the examples in here, what might public health need to do or have the opportunity to do to work more effectively with business, and what might business have the opportunity to do to work more effectively with the public health world if we're bringing at least these two sectors together? And you gave one example as maybe they could walk to each other's buildings once in a while. But any other, as you've been dwelling in this and considering it in a serious way now for maybe a year now, but certainly many months, and bringing the brightest of minds together on it, what are you learning and thinking about?
So certainly a solid dose of cross-cultural understanding is needed. And again, speaking from the public health side, I'll say maybe a sense of shared ownership. Public health people like to be leaders. We like to own what we do. We like to go full speed ahead with our idea of policy systems, environmental change. That's one of our mantras. We don't necessarily engage others well in terms of understanding what are your goals. We're happy to say, this is what we're doing, it's the right thing to do, it's the good thing to do, we're saving lives, come to our table. We're less good at saying, may I join your table? Tell me about what you're doing. What are you trying to achieve? And let me think about how that relates to what I'm trying to achieve, and maybe we can work together and achieve both of those goals.
Yeah, and so I think Ursula is spot on there, and I've learned a lot, many from Ursula and Doug Judy, our other colleagues. But I would say on the business side, a couple of things. I think I've already signaled humility. I think that we live in a society that business leaders are celebrities. We're known to have funds. We live in a society where more funds are associated with, for a lot of people, better logic, better knowledge, than perhaps we always truly have. And so I have a strong encouragement, and you'll see a strong encouragement in our document, for business people that would read it to be humble and to listen more. The second thing I would say, there are a lot of examples in this, but I'll bring out one. We have a wonderful section that really deals with the question of place. Why place matters. Why would the metric, the unit of measurement that is a neighborhood or a community matter? Why does it matter in people's lives, and why should it matter to business? There are two reasons why I will just share with you all, for those that are business people. These are somewhat counterintuitive for business people. So we live in a world in business where we believe in maximizing supply chains such that we move plants, close plants, and bring resources to the places where we can drive the best efficiency. And that usually means lower cost per unit volume. So if we can make something in X and it's perceived by us to be more expensive, we will move it to Y. And if that means we move it out of the United States, we're happy to do that. That's one logic. There's a logic in business. We should find the place that if it's a bad neighborhood or a tough neighborhood or what one of our writers calls a low opportunity neighborhood, that's just not a place we need to do business. Let's find a different place. By the way, I should say coincidentally, I sit on the Economic Development Authority for the state of Virginia, where we talk about bringing new companies in, and we're the ones who brought Amazon here. We talk about the benefits of a community, and businesses often think we will move plants and people to where we can get the best deal. That's a logic I think we're trying to turn on its head, that we do have a stake in the community in which the plant is currently operating and the people that are there. I say this as GM announced 5 plant closings last week. The second logic that I think we are trying to undercut with this is, I heard again a little bit of it in the past panel. There is a Darwinistic view in business, and business people have this view, that and it goes like this, as ugly as it is, folks, it goes like this. The reason these people have health problems is because they are the problem. And if they would just simply stop smoking and stop drinking and go out and join a gym like those of us do and get a trainer, they wouldn't have these problems. And that's tied to a logic in business that those of us in business who have achieved have because we're smarter, we're better. We're more disciplined than those people. And so I think this report is also disabusing readers of the presumption that some business people will have that our system has rewarded those who deserve to be rewarded, and those who happen to be having a combination of factors, poverty, but also health disparities. They're having those problems because it's their fault. And we're trying to disabuse readers of that assumption.
So in that regard, why is it, or is it, in fact, the role of public health to address poverty and income inequality, lack of economic opportunity, et cetera? And if let's just talk about that. Is that the role of public health, or whose job is that?
You know, those deeply entrenched and complex those social conditions, deeply entrenched social conditions, complex social conditions, those are the drivers. Those are the root causes of the health conditions that we're dealing with today. You know, we think in public health that if we change the behavior, if we can prevent the smoking, if we can reduce obesity, if we can improve nutrition, increase physical activity, we can prevent the heart disease, the cancer, the diabetes, and so forth. And there's certainly truth to that, and public health works very aggressively in that space of behavior change. I think what we're realizing is that those behaviors are already pretty far down that disease pathway, and that there are antecedents of those behaviors that we've been quantifying in public health for decades. You know, we've known forever that people with lower levels of educational attainment are more likely to have obesity or have diabetes or die of heart disease. People with lower incomes are more likely to have lower life expectancies. People who are unemployed are more likely to have chronic conditions. So we've known about those relationships and those root causes But we haven't moved to, we haven't seen it as part of our public health role to address poverty. There are other people who do that, to address educational attainment. There are other people who do that. You know, we'll stay in our swim lane, we'll do this. And there's, to use Greg's term, a logic to that. There are reasons that we choose to do that. We don't have infinite funds, we don't have infinite bandwidth. But it's a very siloed approach to deeply entrenched and complex social problems, and we cannot take a siloed approach to those problems. So for public health to gain the full picture of what's driving the burden of disease that we are struggling mightily with as a country now, to recognize that there are entities that we can partner with, that we can work with, to address some of those root causes, those drivers, to recognize that business actually also has an interest. Maybe they don't know that they have an interest in addressing poverty and low educational attainment and joblessness and so forth, but they do know that they're paying for healthcare costs. They do know that they're struggling with recruitment and retention. They do know that they're struggling with productivity. So let's align some of these problems and solutions, and let's make sure that we're talking to the folks next door, as well as the folks in this building, as well as the businesses in our community, so that we can figure out who's doing what and how are we all going to solve our problems together.
Great. So, Greg, how about the business sector then? Do they have a role in influencing inequality, public health disparities? And if so, what can the business be doing about this? And are they part of the problem or part of the solution or both?
That's a lot. The word responsibility is an interesting word, and it's always one that I think you'll find in business sector discussions. I think people will acknowledge roles and be uncomfortable with the word responsibility. I think you'll find that that word will produce a different reaction, even if the remainder of the sentence is the same. I would secondly say that there are, again, some belief systems. A frequently used phrase is, the rising tide raises all boats. So we all know it. It's frequently said. I think the nation, and certainly business leaders, are realizing that that's not exactly what has happened. That inequality has actually increased over time, even as GDP has continued to rise, even as the stock market over the last, well, since the recession, has been one of the best markets we've ever had. But when we consider who has stock and who doesn't, we have some realizations about the reality of that. So I think in some ways that first cow, sacred cow, is the rising tide raises all boats. I'm not sure that it does. And so I think there's a greater acknowledgement. Some of you will know a very sizable group of business leaders came out just about a month and a half ago and said, like, we do have a role. Again, the word responsibility probably trips people up. I think there's an acknowledgement that inequality in all of the Western nations has gone to a place that I don't think we anticipated it would be. Now, after acknowledging the problem, the symptoms, then the question becomes, what are we going to do about it prescriptively? And so I think we, in this nation, are at a place where there is an acknowledgement that inequality is out of line. And even so, and the reasons people care about it might be different, but one reason is people are worried that if our Gini ratios and our inequality continues in the way that it has, it's not only hampering productivity, and we acknowledge that, but people who are economists know that when Gini ratios fall too far out of whack, you usually have a revolution. And so this is talked about. And so there is a notion that we need to do something. Now, the what is the more complicated question. And so I think the dialogue that Ursula and I are in, and will be in hopefully with you all, will be more about the what. But I think I'm trying to say that the moment of acknowledging inequality is too high. Rising tide is not raising all boats. If we don't do something, either the underpinnings of the employment base, the underpinnings of the consumer base, or social cohesion will fall apart. And so I think most business people know that and will agree with it. They don't want to be taxed. And there are other things they don't want, but the question will be, what do we do about it? But we're at the acknowledgement stage.
So you mentioned early in your comments about the state of settled science, and that typically, both of you used that phrase, and that typically a Surgeon General's report would be about the state of settled science. And Greg, you mentioned settled science as well. And maybe we should talk about to what degree are we in settled science, and how might that either be a barrier or really not a barrier? That does it prohibit us from addressing? I mean, you just mentioned some things which people feel pretty strongly about that have some degree of certainty in terms of the wealth divide kind of things. So where are we at with this settled science construct and this Surgeon General's report?
So I'm chuckling because one thing that Greg has educated me on is that businesses have to make decisions today. And they make decisions based on the information that they have at hand. Whereas in public health, we like the weight of the evidence, the Cochrane Review, the 3 years of study, and then when we come to a conclusion, we caveat it to pieces. You know, this is the statement, but if then with this standard deviation, you know, and these confidence intervals. So it's very hard, actually, for us to communicate effectively, certainly to businesses and probably to the population as well, although we're getting better at it. So maybe settled science isn't even a question that businesses would ask, but do we have enough information to understand a problem and to make some recommendations about how we might work together to address that problem? So I think in that sense, that's the spirit in which we are moving forward with this report. We don't have the settled science, the weight of the evidence. And I'll caveat that by saying that what I mean is we don't have the evidence to say that if businesses invest in a community in order to improve population health, that the community will become healthier and the business will receive a return on that investment, right? We've just never studied that question. Even where I just talked about those root causes, so the decades of work in around poverty mitigation, the decades of work to improve high school graduation, for example. So we know that we can do those things, and we know that there's a return on that investment to society in terms of taxes paid, in terms of income earned over a lifetime. We haven't really measured and what are the specific health impacts of that. So there's lots of dots that we can connect, but we can't quite exactly connect the dots for the thesis that we are putting on the table with this report. But I think we feel like there's enough information that we can make a case, we can share some experiences and perspectives, and we can put forward a vision for where we need to go as a society.
I mean, I guess my thought about that is that in the average business leader's day, someone who's making a business decision, they are asked, have you done your diligence? Have you proceeded to find what data we have on whatever the investment may be? And have you sought out both positive and negative exemplars? But having done that, and yes, I have sort of signaled this to Ursula and my colleagues, you do have to go. We're going to have to go here. So I'm off the top of my head, if I'm at Amazon and I'm running one of Amazon's fulfillment facilities, we decided at a certain point we're going to staff robots to do a lot of that work. And in fact, robots do a lot of that work. They bring you your stuff within 2 days, which so many people like. They don't spend years testing whether robots are going to work. Somebody's in a room, they say the robot's going to do it quicker, and they go ahead and they're willing to take the risk to make the investment under the presumption it will work. And we in business accept that we're not always right about the risk we take. And so the caveating and controlled studies methodology, which is really great, I'm an academic too. Control studies are great. They're wonderful, you have them. But I don't know that business leaders need those to make decisions regularly. No, I would say when we begin the dialogue between the two sectors, there probably will be some educating you all would do based on your depth of knowledge that would be reassuring to people in business. But the notion that I need 8 studies and a meta-analysis, I generally don't need those to make business decisions.
And the reality is you're making a prudent course of action decision, and even failing to act is a decision, or deciding to not act is a decision. So decisions are made every day. Okay, so in the spirit of these partnerships, we've been talking about business and public health, and there's another entity here. I wondered if both of you could comment on, where does healthcare fit in this? Are they a business? Are they some sort of a third-party institution? What's their role in this whole milieu that we're talking about in terms of community health and economic prosperity?
Ursula, please clean up for the mistakes I made. So by happenstance, I work at the University of Virginia, and because of that, I bring it up to say half of all employees at the University of Virginia and more than half of the base of the dollars flowing through the University of Virginia actually flow through the medical enterprises of the University of Virginia. The University of Virginia then has one unit in our grasp that is a business that runs 24 hours a day and is open every day of the week, and it's our hospital. We are an anchor institution, and we employ the vast majority of the people in the city of Charlottesville. And if we think about the spillover effects of the other people who don't work directly at the hospital but are touched by the hospital system and its activities, then we've already covered quite a bit of what happens in my city. Additionally, college towns all over the country are typified by, most people don't know this, huge achievement and inequality gaps. All of them are. Could be State College, could be Chapel Hill, any of these cities. They're all having the same problem. And so we in colleges recognize, in my college, I'll just speak for the University of Virginia. At the University of Virginia, we realize that our hospital is an employer, an engine of economic growth, a unit that, because we are a public hospital, serves the health needs of the indigent, and we recognize that our university contributes to the inequality in our community at the same time. And so if that's one example, I'll use it because I also know, given my work in economic development, in many small and rural communities in the United States, the hospital system is the primary employer, period. So I think it's a multivalent relationship with the healthcare industry in that regard. And now I defer to my colleagues.
So I agree with that. Again, from the public health perspective, I think we often turn to healthcare for their role in delivering medical care. We don't often turn to them as a business and as a major business, typically, in a community. In the morning session, John Macchione from San Diego County said, and by the way, government's a business too. You know, it's not a profit-making business, but it's an employer, and we can run ourselves like a business. So I would say the things that I'm going to say about working with hospitals as a business, and some of them, of course, are not-for-profit businesses, also apply to us in the public sector working for governments as a business. There's a lot that we both can do to improve communities and improve community health in terms of the way we run our business. So are we hiring locally? Are we procuring locally? Are we investing in the local economy? What is our wage structure? What's the ratio of our salaries and wages up the chain? What's our benefit structure? What kinds of career ladders are we creating for people with all sorts of educational backgrounds, including those who maybe don't have a high school diploma? So looking at our roles in a community as a business instead of in the delivery of public health services or healthcare services can be a motivator for other businesses, but also because of the size of those public businesses and those healthcare businesses can be a pretty substantial community change maker.
So what about policy? Where does policy or policy incentives fit into community health and economic prosperity? And does the report touch on policy at all?
There are lots of policies within policy levers that businesses have direct control over because they're internal business decisions. Their wage and benefits package, that's a policy. Their leave benefits, that's a policy. Safety and health issues, those are policies. Those can really transform if you're lacking in any of those areas. Changing those policies can really transform the lives of your employees. That goes for government workers as well. Responsible marketing practices, those are business policies. Reducing environmental impacts in a community, those are business policies. So businesses have their hands on a number of policy levers, and of course governments do as well. In terms of incentives for businesses to and government to think about these issues, we have to make the case. We've talked a lot here about value, shared value, creating value. Making the case that there is a value to be obtained by business, by government, for investment in these kinds of policies, for investment in communities, I think is how we incentivize that kind of investment.
I couldn't agree more, but we'll take a slightly different path. So the degree to which there are incentives that would then reify and provide economic imperatives that will encourage the type of innovations we want would be the types of things that I would think from a public policy level we want to see more of. So let me give just a couple of examples. Ursula's earlier mentioned the community development finance industry. I don't know how many people in this room know what that is. But these are financial intermediaries that make it their business to deploy capital in low-income communities. By the way, a substantial portion of that deployment is not just on economic health. You can think about affordable housing, we can think about charter schools, we can go down a huge list there. One of the things they do is they also spend a good bit of money on health clinics, health education. I mean, if we wanted to just focus on that narrow aspect, early childhood education in preschools, all are part of the CDFI mission. And what these organizations do is through a combination of government and nonprofit dollars, they were able to lower what we call the investment hurdle rates for certain types of investments that businesses might want to be involved in. And then they're also bringing subject matter expertise to the table. In this case, it could be expertise about what's best for people in upstream and downstreaming type activity that we don't know about. The related example is one I just mentioned. I don't know how many people in this room know much about the Opportunity Zone legislation. And this is not a commercial for that legislation. It just is what it is. As part of the changes in the tax code, there is a attractive to investors opportunity to not have to pay capital gains tax and to place those investments in low-income and underserved areas around the country. And those investments have received a good bit of press, both positive and negative. But here's the thing. Given where those investments will be going physically, some of those investments could easily find their way into activities that happen in organizations not unlike the ones I assume you all represent. And those investments coming from relatively affluent people who want to do something with their capital gains could be a means and mechanism to encourage the type of understanding of a more fullness in society that I think we want. And so I use those two as examples where we take the notion that we all work together and we put actual incentives, capital dollars, to do that.
So we've talked about there being a number of challenges here. There's language challenges and trust challenges and various barriers that have kept us from perhaps being in the ideal situation here of advancing community health and economic prosperity. During this work, and maybe because of it, what have you come upon which are those bright spots, those elements that give you a sense of hope that we're on the potential for a trajectory to be more successful going forward from here? And could you both speak to sort of those elements?
So I've had an opportunity with the Surgeon General to speak to so many businesses. And the bright spots that I especially love are when businesses describe a problem that they are struggling with or have struggled with. And usually in this environment, it's recruitment and retention. They can't hire. And they think about a different way to solve that problem. And that different way to solve that problem actually has a huge community benefit. So I can just put a couple of examples on the table. The Surgeon General and I were in Baltimore on Monday, talking to what some people refer to as opportunity youth or disconnected youth, people between the ages of 16 and 24 who aren't in school, aren't in training, aren't employed. They're just kind of out there. And over the lifetime, they're very costly to society in terms of they're not earning money, they're not contributing to taxes, to Social Security. Sometimes they're availing themselves of services like incarceration or WIC and so forth that maybe they wouldn't otherwise. So there's a cost of about $50 billion a year for these kids who actually are pretty easy to connect if we focus on that. So Hyatt and Bank of America were both part of this discussion, not talking about philanthropy, not talking about charity, but talking about talent acquisition and talent management and building career ladders and how critical these youth are to bring into and enrich the talent of their organizations. So they have goals of hiring thousands upon thousands of opportunity youth because it's good for the company, because it's a way for them to access talent, loyal talent, talent that stays with them, talent that grows with the company. One second example that the Surgeon General loves to describe is Belden Industries in Richmond, Indiana, which in that part of the country, across the whole country, we're in the midst of an opioid epidemic. Richmond is particularly hard hit. And it was very difficult for Belden to fill positions that where prospective employees had to pass a drug test. So what Belden did, instead of just keep advertising or try to bring people in from elsewhere, was say, we will put you through drug treatment. If you complete treatment, we will hire you. While you're our employee, we will continue to support you in your recovery. So they've been able to hire dozens of employees through this process, employees who have really transformed individually, as family members, as community members, and as employees. So those kinds of solutions that solve a business problem really are inspiring to us.
Thank you.
All right.
Yeah, I didn't know about that second one. The second one is intriguing to me only because, you know, I was in a conversation with some people about alternate sentencing and what are called drug courts, and this idea that we are incarcerating far more people than we need to, certainly in many cases because they are addicted, and we're trying to find alternate ways, including partnering with businesses. And so I didn't know about this model, but that's fascinating and relates to some other things I've seen. By the way, you could imagine then there being a business connection, but also in this instance, there's a judicial effort to try to change our judicial system, and these two things are coming together. You know, there are many, for those, it sounds like a commercial, when you read the report, there'll be many examples you can see. But, and we've tried to have maximal range. So we've tried to do things that range from large corporations that you would recognize to companies that you might not. Recognizing, by the way, that half of all people in the United States work in a firm with fewer than 50 employees. So we can often talk about our friends at major multinationals, and that would be easy, but that really only covers half of the installed base of workers. With that in mind, two come to, that I'll just throw out because they resonate with me in some ways. Hillenbrand Company is in Batesville, Indiana. I don't know if anyone in this room knows that company. It's also known as the Batesville Casket Company, which was its original name. And the reason is because it is the nation's, North America's, largest leader in death care products. Yes, that's correct, death care products. When people die, they produce caskets and urns and the things you need. They're the best at it. They really are. They also are a prime employer in a town called Batesville, Indiana. And they are engaged in all the things that Ursula and I talked about earlier about anchor institutions, but also partnerships with a range of entities in Batesville to actually make sure some of the things that Ursula talked about in a small town in Indiana don't happen and or are dealt with as they do happen. And so I'll commend you and when we get this thing out, or to you look at Batesville on your own. It's an interesting town and an interesting company. You know, the other one I think of is not one that we are featuring a Native American nation and their activities as a part of what we're doing in the report. But and this is not the one I'm going to talk about, but years ago I went out to Tecumseh, Oklahoma to visit with the Potawatomi Nation and some of the efforts they had made to do a number of things, to expand the portfolio of businesses that operate in the Potawatomi Nation, but also to recognize that there are significant health disparities, educational disparities for all Native Americans living in that part of Oklahoma, and certainly for Potawatomi specifically. And so what I love about that story, quite honestly, is the very close integration between the business itself and a sense of self-sufficiency among the people in the community that is the nation, but also other people that aren't a part of the Potawatomi Nation that are in that area. And there's a recognition of all the way all those things come together, and I've always found that particular example, and the example that we do have in the report will also be, I think, motivating to you all, as the types of ways that companies can do things that we might not think that they do.
Well, thank you. I had promised an opportunity for questions, so I think we have a short window, very short window for some questions. Please go to the microphone.
So this is Katie Adamson with the YMCA, and I just wanted to, first off, wahoo wah, even in the colors today, right? But we did comment during the comment period on the report, but I don't think I commented on this, which is really to Greg's point. WISE have been finding the new market tax credit, have been introduced to it. There's a great story in West Louisville of a Y there. It's a community that hasn't had an investment in 50 years. 40% of the population is using the hospital ER for primary care. It had a tobacco industry shut down, a big production plant there. So they asked the community what it would take to really turn it around and make it prosperous there. And they said their kids needed jobs, so they engaged Best Buy to do technology training for the kids. They said they needed a substance abuse rehab center, so they've engaged a rehab mental health facility. They've worked with Norton Healthcare for primary care, which is a community health center. They have brought Republic Bank to the table to do financial literacy because they have a huge debt problem there. And the Y is doing some of the cardiac rehab, and so they have a swimming pool they wanted. There's also an early childhood center. So basically they were responding to what the community said it was going to take to be prosperous and well. And it either opened last week or this week, but we have multiple examples of WISE and community health centers co-locating. But I think what's unique about this is it's recognizing the multiple challenges the community is facing to be well. And it's engaging business in the solution. And they will all say it's not about the building, it's about what the community needed to be well. And so it's an interesting model you guys might want to look at. New market tax credit ends at the end of this year, so we were recently engaged by some businesses that says, you guys are all over the map doing this work, why don't you be a voice for us? So we're going to step into that space, but only because we're learning about it from the field. So I think it's a very interesting model.
I'll take this as short bite. What I so love about this example is the comprehensive nature of it and the recognition that community problems are complex. There aren't panaceas, and one effort alone doesn't really solve. I won't spend too much time with you, and I should talk separately. The New Markets Tax Credit was something that the CDFI Fund has managed for years and has done amazing work. I've written about it. Healthy foods, for example, is one of the things that the New Markets Tax Credit has been used for. It is not unlike some of the other financial incentives that I mentioned. And in fact, there's some differences that are not needed to talk about now, but it is the type of policy that I would commend us to be more thoughtful about.
Okay, I got the cut sign from those in charge that we're going to have to move on. We will have an opportunity closer to follow up more. What was it, Joe? You gave us the active clapping, so everybody can see it up
Maybe you know the answer to this question for the Surgeon General? So I hate to say we're saving the best for last, but we will assemble the last panel of the day. I was there for a while. But there is someone that's going to do
Waiting for Jessica. Yes. I don't want to start without everyone up here. So for our final fireside chat today, we've got the United Front for Business Engagement. So we're actually going to hear from organizations representing the business community. My name's Jody Mitchell, and I serve as a consultant with the Business Engagement and Obesity Solutions Innovation Collaborative, and we're happy to co-host this day's event. And I think it's been wonderful conversation that we've had. It'll be interesting to see where we take all the feedback that we've gained in the room and what we do with it as far as action. So for this afternoon, I'm pleased to be joined by this esteemed panel. We have Dr. Anand Parekh, from Chief Medical Officer at the Bipartisan Policy Center, and he provides clinical and public health expertise across his organization, particularly in the areas of aging, prevention — he has a new Prevention First book coming out — and global health. I had to plug it. And then we have Stacy Molander, who's the Chief Operations Officer for the Partnership for a Healthier America. And many of you know the Partnership for Healthier America works with private sectors to bring systemic changes that improve food supply and increase physical activity. We have Lawrence Bowdish with the U.S. Chamber Foundation Corporate Citizenship Center, and he works in issue networks and research for the Chamber's Foundation. And then we have Jessica Black with the American Heart Association. She's the Vice President of Community Health, and she leads the organization's strategy focused on maximizing health and well-being in communities and works closely with AHA's local teams in community. So I'm going to have each panelist today just give a brief overview of some of their initiatives in the space of engaging businesses in community health, and then we'll open up to some questions of the panelists and then the audience questions as well. Thank you very much for joining us today. So, Anand, you want to talk about your recent report?
Great. Well, I'm really happy to be here. Jody, thank you for the introduction, and thank you to the panelists and all of you today. I wanted to share just for a few minutes a little bit about our work at the Bipartisan Policy Center. I think most of you know who we are, but we're a nonprofit organization in town that tries to take the best ideas from both political parties to promote health, security, and opportunity. We have a pretty robust health portfolio at BPC, and part of that portfolio several years ago, and I think Jody was alluding to this, we had set up a CEO Council on Health Innovation with leading businesses, Verizon, for example, Bank of America, as well as others, to really talk about how the business sector could start to play a larger role in not just paying out for healthcare services and interventions, but really improving health. And I think it was through those conversations, as well as some of the activities of that council, that we all realized that more needed to be done, more could be done by businesses to engage community. And I think some of this is really the conversation we've been having, all of us, for the last 2 decades in health. You know, the whole conversation of how do you move beyond the 4 walls of the clinical setting to really improve health. And we know now that, the determinants of health impact much more or have a greater impact on what folks like I can do in the clinical setting. And so that realization that we've made over the last 2 decades in healthcare. I think communicating that to the business sector so they understand that, I think, is something that we came to the realization that was important, and not to take that for granted. And so helping businesses understand that health is more than just healthcare spending. It's more than worksite wellness. It's more than just a focus on individual employees, for example. But if you really want to improve health, if you really want to reduce preventable healthcare costs, you need to look outside the healthcare setting. So just educating our colleagues about that, we thought was pretty important, and certainly something that can't be taken for granted. We're still trying to do that within our sector, so we shouldn't take it for granted when we communicate with other sectors. So through that, the area for the last year that we chose to focus on in terms of how to get businesses involved in the community is to pick a partner. And we selected one partner, which is local public health. And given sort of public health and the infrastructure in this country, 3,000 plus local health departments, we thought, what better public-private partnership? Certainly there are many other entities in a community that businesses may want to partner with. Public health departments, governmental public health departments are just one. But we thought, what better entity than partnerships between public health departments and either a local employer or a local chamber to really come together and figure out ways they could work together. How do you speak the same language? Are there mutual goals? What are the barriers that need to be overcome? How can resources be shared? And in our initial research, Jody, we didn't feel that the value proposition had been laid out. Why should sort of businesses approach public health departments and vice versa? So in collaboration with the de Beaumont Foundation, NACCHO, the U.S. Chamber of Commerce Foundation, we undertook a study to ascertain across the country, where are these partnerships between local public health and local businesses? How do they come into being? Which ones are successful? Which ones are actually measuring outcomes? Where can we share best practices? What are lessons learned? What's the elevator pitch? In 30 seconds, if you're of one sector to the other sector. And so we engaged in this type of research, and just a couple of months ago, released this report, Good Health is Good Business, which really summarizes, I think, our findings. And I would say probably there are 3 main takeaway points. The first is, I would say personally, I was a little bit surprised, and Lawrence and others may want to chime in. I was personally surprised at how, and there are probably many collaborations ongoing, but how few collaborations are talked about or discussed or published in the form of case studies or case reports. We did find a few. There's tremendous work going on across the country, Oklahoma City, Kansas City, Missouri, where chamber foundations and public health departments came together. I remember in Kansas City, one specific effort, a T21 effort to try to raise the minimum age of tobacco sales from 18 to 21, where both the chamber and the health department came together, had a goal of reaching 5 local jurisdictions within 3 years, and actually got up to 30 jurisdictions passing increased tobacco sales age policy. So there are examples out there that we covered in our report, but I think the first sort of message was we need to make sure that collaborations out there are able to get the word out, that we can publish this so others can learn lessons and share best practices. So I think that's one. The second is we basically synthesized the value proposition for both sectors to be able to work with one another. And I think, for why should businesses care about public health, it was essentially, look, public health has a lot of unique aspects to it. It's got credibility, it's got evidence, it's got data, it knows sort of the science, it's a trusted partner, it's got relationships with other community organizations. And if you're a business and you're looking to improve employee health, employee morale, attract a new talent pool, control costs, not only for employees, but their relatives, their loved ones, increase the consumer base by ensuring there's a healthier community. Those are the types of partners you need. And so just laying out what the value proposition for both sides was that we thought was pretty important. And then the report really tries to tackle some of the issues that all of you have talked about today. How do you overcome barriers, whether it's language, whether it's conflict of interest, which is oftentimes perceived more than anything else, and then how do you build a partnership? What are how do you identify what a low-hanging fruit is? And various other aspects of ensuring that you can have a successful relationship. And so that's really what the report does. In one word, if I could summarize the hope and the impact of the report, I hope it's to catalyze conversations as well as catalyze relationships across the country. There is no reason why in 3 or 5 or 10 years in all 3,000 communities across the country we can't have health departments as well as businesses partner, to improve health, to improve a community's health in one way or another. That should be something that we ought to be striving for. Every local health officer ought to have that within their mission. And I think every business, from the business side, every sort of major local CEO should be able to tell you what their health department does. And why that's important to them. So these are sort of overall overarching goals, but hopefully the report provides some sort of catalyst for future activity. Thanks.
Great. So now we'll hear from Stacy about the Partnership for Healthier America and some of their business commitments.
Sure. Well, thank you, Jody, and thank you for inviting the Partnership for Healthy America to be part of this panel and this conversation today. I'll just share a little bit about what we do at PHA. As Jody mentioned, we work with the private sector specifically to improve the food supply and increase opportunities for physical activity. We like to think that we're really driving towards systems change through our commitment model. And for folks who may not be familiar with that, that is PHA working behind the scenes with both individual companies and entire sectors to really drive what we call voluntary business practice change. And that's specific changes to a company's core business that serve to increase the number of healthier options in the marketplace, really around transforming the marketplace. And I'll put emphasis on that core business piece because I think that is an important part of the conversation. So many times today, I think we talked a lot about employee wellness and we talked a lot about philanthropic donations from companies, but maybe didn't spend a lot of time thinking about the core business. What are the products and services that the company is actually producing, and are they contributing to health or are they not? So that's where PHA is really focused. And I'm probably getting a little, do you hear it is okay? Okay. Okay, great. All right. So the work at PHA, we're about to celebrate our 10th anniversary. We've been around 10 years. Over that time, we worked with over 300 companies, all generating those commitments and partnerships. Just to highlight a few specifically in the sector-wide approach, specifically in the convenience store industry. I think as many of you know in this room, there's so many areas in the country that have low access to fresh fruits and vegetables and healthy food. And in many communities, a local convenience store is the only place they can go for groceries. So PHA has commitments from 10 regional convenience store chains across the country, reaching thousands of locations. And what we've asked the company to commit to doing is increasing the fruits and vegetables, increasing the amount of whole grain, increasing low-fat dairy, really marketing those products so they don't just sit on the shelf, but consumers actually purchase them, and then pricing them affordably so that the healthier option is not the more expensive option compared to others. And then lastly, we do ask those partners to invest in their employees so we capture their employee wellness. So those partners are reaching most of them are about 75% of them are in low access areas. So we feel like that work is hopefully contributing to the access problems we have in our country. Another example I'll give is in the early childhood education space. We have commitments from 4 of the major providers, YMCA being one of them here today, and that very much similar, affecting their core business, having them commit to kids getting fruits and vegetables at every meal or snack, having access to fresh water, getting outside, minimum requirements, limits on screen time. Again, really influencing the way in which they're running their business and making those environments as healthy as possible for our youngest kids. So those are just a few examples of the types of commitments that PHA's had. I think the question really is, why does a company do this? Why would they choose to do that? And I would say sort of twofold. One, and I was thinking about what Nick said earlier today about more and more a CMO being at the table when he's having conversations. PHA is finding the same thing. Companies are looking for credit. They're looking for credit for contributing in a positive way. And if we feel like they're doing something meaningful, PHA is happy to give them that credit. We do that through our communications channels. We have an annual summit, and we really want to highlight and feature those companies that are doing meaningful things to contribute to health. And when they do that, the hope is they see profits and revenue because of it. And I think Maggie was the one who mentioned earlier today, profits doesn't have to be a bad thing. It's the thing that really keeps the work sustainable. And we really believe that at PHA. And the more that we can hear stories about companies making money off healthier options, the more that we want to tell that story, because we do believe that's how we get long-term change. So thanks.
So Lawrence is a member of the Action Collaborative for Business Engagement for Population Health, and he's been involved in this dialogue for quite a while, and the Chamber's done the Health Means Business initiative a couple of years ago. So you've got a lot of experience you could share with us.
Like it or not. So thanks. Good afternoon, everyone. Really appreciate the opportunity from the National Academies to come here and speak on some of the work that the Chamber Foundation is doing. My colleague, Elise Cohen, is more of the health person about this. I'm more of the boring metrics person about this. So apologies if this is going to be as exciting. I'm probably the least knowledgeable public health person in the room, so I'm going to depend a lot more on data, numbers, and things like that than others. In addition, I've been paying attention all day, and so I have cut and edited my comments, so hopefully they make sense, but I've tried to not be reiterative and sort of spend time talking about some new stuff, things that haven't been sort of covered too heavily yet. That said, the Chamber of Commerce Foundation is the 501c3 part of the U.S. Chamber of Commerce. My comments people aren't here, so I'm going to stop there. We got involved really in community health about 6 years ago, and that was when we started really looking at our work as these issues that companies are dealing with. And we have people that work on disaster response and sustainability and things of that nature, but we have a separate health and wellness category. And 6 years ago, I'm going to tell this as part of an evolutionary story. 6 years ago, a lot of that work had to do, it started with workplace wellness programs. Right, because that was something that companies found, I think, one of the easier ways to start. We've heard a lot about them. And one of the reasons why workplace wellness programs kind of work for companies is, one, they can be pretty distinct, even if you have different ones across your company. Two, it's a pretty controlled community, so you know more about that. Three, for a long time, if you look at things like the Edelman Trust Barometer, my employer is the most trusted institution for 75% of individuals. And so it's a really useful place to get that type of information, as opposed to trying to do it through government or anyone like that, at least in this sense, if you follow that logic. And so we talked a lot about companies getting involved in workplace wellness programs, and the reason for that is that it made one of the quickest economic business cases. Right. Generally, healthcare for employees is the second biggest output for company expenses. Last year, according to BLS, the private sector offering health care to its employees cost $2.75 per employee per hour they worked. $130 for each employee that worked full time per week. So that, if you can reduce that by percentage points for companies, that's a quick way to do it in a way that dealing with a lot of health things doesn't have a really quick turnaround a lot of the time. And if you look at, there was a recent study a couple months came out by Song and Baker that looked at the largest randomized controlled trial study of a workplace wellness program. They looked at 33,000 employees at BJ's Wholesale Club. And what they did is they worked with BJ's over the past 3 years, and they said, we want you to execute with 4,000 employees across your stores this workplace wellness program. And for 29,000 of them, they'll be the control. And we're going to see what happens. And they measured 29 different distinct outputs. So things that were self-reported, actual changes in biometrics, changes in healthcare, presenteeism, things like that. Out of the 29 outcomes they were measuring, 2 of them improved for the control group. And that was people people claiming they were actively maintaining their weight. They weren't biometrically. And 2, people that claimed they felt better, right? Not everything else, presenteeism, absenteeism, job tenure, promotion, all of that, none of that changed when you're doing the workplace wellness programs. Now, I'm not saying this to throw a wet blanket over everyone trying to execute this type of work, but one of the issues they had with that study was that they couldn't control for the communities that they lived in. And companies have been realizing this for a long time. BJ's is not a member of ours. I would have told them this 4 years ago, and they could have avoided all of this. But a lot of companies are realizing they need to get involved into the communities in which they live in. And that's important for a couple of reasons. It's important because the communities are the people you're selling products to, if that's something that we want to talk about, the real health and wealth connection on an individual level. And it's also going to be where you're going to draw your employee pool from. And there's 2 important BLS statistics I want to bring up about that. 1, 40% of individuals never leave their hometown. So if you're a company that wants to grow, there you go, thank you. So if you're a company that wants to grow locally, you are not going to be able to dependably bring in outside talent. Or if you are, you're going to pay dearly for it. So why don't you improve, pick up your bucket where you are, to quote Booker T. Washington. The second part about that is that July, the last month for which we have numbers, 2.4% of the American labor force voluntarily walked off the job. The highest number since we've been tracking. Now, these are not people that have been fired. They're not layoffs. They're not retirements. These are people voluntarily quitting their jobs. 1 out of 40 left in July of 2019. Which means, everyone talks about there's a war for talent. Well, there is, and talent won, right? And so as companies think about, not only do we need to be able to maintain the talent we have in-house, which is important for these workplace wellness programs, and we've been talking about that's what folks want. You've also got to have your upstream, as Professor Fairchild talked about, you have to have your upstream group ready to roll as well, which is why a lot of companies will deal with children and youth they're not hiring for years and years and years, but they know that by the time they can actually impact them and impact their families, when they do come up and they go to college and come out in 10, 15, 20 years, they're going to have the behavior changes likely to be needed for the employment. And so that's how we are evolving in our work. So a lot of companies we do are now heavily involved in community work. You've heard a lot of stories about that. The other thing that we're involving on is in 2 ways. One, we're looking at a little more in the mental health space. The Chamber Foundation broadly has a separate opioid issue that we're helping with but not running. We are also doing something in mental health. We're also trying to get engaged in financial health and wellness. Now, I don't want to claim that you can sort of budget your way out of poverty. That's not the case. But one last statistic I'll throw at you. For people's wealth, that's only 40 to 60% determined by their income. So the other half, you can't change people's inheritance, but you can change their behaviors. Right, and so we're trying to work with companies and their employees, like what are the behaviors you can change to help with that? And there's a lot of things, obviously, people's financial health is well attracted to how they are physically healthy. So that's sort of where we're moving now and how we sort of evolved from 2013 to now moving forward. But happy to take some questions at the end.
And you're doing some work locally in Grand Rapids, right?
Oh, we have, yes. That was largely due on 2 main things. Grand Rapids, the folks there were really interested in both their maternal health. Grand Rapids has some of the lowest maternal health rates for any city in the U.S., and also food security, which is needs help but isn't as far off. But they were really trying to get companies together to figure that out. Yeah.
And then we have Jessica with the American Heart Association, and I know the American Heart Association has a CEO roundtable as well, so there's an engagement process there, and you're doing a lot of work in workplace health and creating healthy environments at the workplace. So I'll let you talk more about your efforts.
Well, and similar to the organizations sitting here, and many of you sitting out there, we work sort of across the continuum with companies, be it at the federal, state, or local level, both inside the workplace and outside the workplace. And in fact, many of us have worked together in various capacities. We did a meeting earlier this year at the National Chamber Foundation. So I know there's a lot of great synergy in the room, and it's really exciting to hear the different perspectives. Starting with sort of that big macro level, talking about the Heart Association's work with corporations relative to health, our story sort of tracks a little bit with the National Chamber Foundation in that we have worked for a long time with businesses, both in terms of their employee health as well as sort of thinking about how they might impact the health more broadly. And in 2013, our CEO, Nancy Brown, brought together a host of CEOs from some of the biggest companies in the country. So again, kind of going back to those macro organizations, because there was a general sense that although all of those different organizations were doing a lot in order to promote their own employee health and well-being, there wasn't necessarily a great opportunity to look at that data collectively and perhaps to learn some of the lessons that could otherwise be learned around what was truly working and what the needs really were moving forward. And so in kind of coming together and looking at that more collaboratively and more transparently among each other, they developed some tools and resources to help both their work, but also kind of the work more broadly. So we have the Workplace Health Achievement Index, which is free and available to any business, but it's a means of sort of evaluating where different companies are, not just relative to programming, which I think is so often kind of where we go in that employee health space, but also the systems and environments in which we're asking our employees or their families to operate on a regular basis. And that particular instrument also has an opportunity to then input employee data, either individually or in aggregate via sort of other health channels, so that one can look at sort of what are our systems and environments as they relate to best and better and evidence-based practices, but also then how does that relate to our employee health and how might that work over time? So that's an available tool, and we, based on the companies who are participate in that, are able to do some research and look at sort of what are the outcomes and what are the trends and what are we seeing the needs moving forward. And then also we recognize those companies who are operating with best practices to try to reinforce that and lift up those stories. There's also some support materials like a workplace playbook, so that for those companies that perhaps are smaller or don't necessarily have as much means to, put together these robust approaches, that they can learn from those who have gone before them in doing that. And so that's sort of where that started. More recently, again, somewhat analogous to what others have been finding, that work has really pivoted in two ways. One, there's been greater exploration of the role those companies and others are playing in the communities broadly. There's a tremendous recognition that how healthy our employees are and how healthy their families are and their presence and their focus at work is largely influenced by the world in which they live outside of the employee walls or outside of the employer walls. And also, as the workplace changes, and in many cases people aren't sitting in offices, their office is the community in many cases, more so even than before, even in more traditional work environments. So an increased interest in that and lots of terrific initiatives happening in that arena that we work with, not only sort of in that aggregate sense, but we also work in over 100 communities around the country locally with different companies in those community the action that I'll talk about in a second. But the other pivot that the CEO Roundtable made was really a focus on mental health as well, that in exploring the issues that were emerging and perhaps most urgent for businesses, there was an increasing recognition that we had perhaps undervalued or under-focused on stress and well-being and some of these other issues that were in lives. And so in conducting a poll with the CEO Roundtable, looking at employees broadly, not just in their companies, but sort of across the spectrum, we found that 96% of employees consider their mental health as important as physical health. And so from the lens of those working in the environment, of course we should be focused equally on mental health and physical health, and yet there aren't the resources, there aren't the benefits, there's not the same acknowledgement or respect necessarily for those issues. And so obviously there was a gap there. But then the other thing they found was 88% of those employees thought their employer should be playing an active role in helping them with mental health. So it was absolutely a gap that needed to be filled, because there was an expectation that just as I consider my physical health as important as my mental health, I expect you as my employer to also do that and to also help me. And in many cases, I may consider my employee part of the challenge if I feel that the stress induced by work or the lack of acknowledgement of the other stressors in my life aren't being managed well. So that sort of set them on a course, and in this spring published a a report on sort of the role that employers can play in that broader mental health space, both inside and outside the workplace. So lots of things happening there. And then the other one I'll mention, and then obviously open for questions, is our work locally, working with businesses, and in many cases, working collaboratively and in fact even collectively, and I know that we've discussed somewhat today sort of the different definitions of that work, but to focus on some of these macro community issues that are driving health and well-being in our communities, that there are roles to be played by every sector. We absolutely need public health. We absolutely need nonprofit. We need education. We need corporate. We need all of those different sort of assets to come together in looking at what those mutually reinforcing activities can be that ultimately can drive towards common solutions. So bringing businesses into those conversations, which we have found has been to some extent a growth opportunity, perhaps for those organizations and also for our own, in that often if we really want to come up with co-created quality community solutions that are going to be sustainable and have the support of the community, that we can't come to the table with the expectation that we have all the answers, and that we've already decided what the solution is and we're here to help and here's what we're going to do. And sometimes when we partner, there can be a tendency among businesses and nonprofits and public health, everybody kind of runs that same trap of feeling like, but we know what you should do, or I'm funding it, so I should decide. Instead of saying, what we really need to do is assess what the assets and the opportunities are within the community and where the strengths are, and how do we come together to reinforce that so that we can see that long-term outcome and that sustainable outcome that really has that community buy-in. And so I think moving all of us who may have some sort of structural norms around how we operate, towards that more truly co-collaborate, collective process has been an important step towards hopefully seeing greater outcomes, and, the evaluation is ongoing, so we will learn more as we go.
Well, thank you very much. I think we'll jump in. We have a couple of questions already that we've discussed that we're going to raise, and then we'll open it up also to comments or questions from the audience. But for the first question we've heard a lot about community engagement, and we're talking about engaging businesses in community. But that definition of community could mean something different in a business sense to then what a local or regional operation. So how do you feel like community is defined for this purpose of engagement particularly? Because if we operate under a shared definition, we might be able to address this in certain ways. Stacey, do you want to address that?
It's a great question, Jody, and I think historically we've found that companies really define community as the place where they do business, whether it's a headquarters or a distribution center or what have you, and they've assisted that community really through philanthropic donations. At PHA, we definitely think about community more broadly, and, as I mentioned before, when we're really focused on the core business of a corporation, we'd like to think community also includes their customers and consumers, because they're the ones that business are impacting day in and day out, as well as their employees. So we historically have taken a broader view of community, and this was already referenced a couple times today, but I feel like it's worth acknowledging again, and that is the recent statement back in August by the Business Roundtable, saying that it's time to sort of redefine a purpose of a corporation and really putting shareholders at the bottom of that list. I mean, that list was number 1, customers, number 2, employees, number 3, suppliers, number 4, communities, and then 5th with stakeholders. And I think it came up in the last panel that, it remains to be seen what actions will be taken to reflect that. But we do think that's a good acknowledgement that we're taking a broader view, and I think broader society and people in local communities are really demanding and requiring that type of viewpoint.
Does anyone else want to chime in on community and your definition of community? No, we're good.
I'll just for a second just build on Stacey's points that, I think in many ways where employees reside and where potential customers reside are really where businesses need to focus, because at the end of the day, it's how do you influence policies, systems, and environmental changes in the communities where your employees and your consumers live to really improve health, and that'll then have positive consequences for the bottom line as well as the objectives of the business.
we'll take the question from the middle of the room.
Hi, thanks so much for really raising the energy level at 3 o'clock in the afternoon. That's not easy to do. And with apologies to Nick, you've become my favorite panel. A couple of you addressed things that we're frankly struggling with a little bit, and you can, if you have examples now or other resources you can refer us to, but we've been, for a couple of years now, saying the same sorts of things about employee wellness programs. It's like, great, they feel good, but, Zumba in the cafeteria on Tuesdays isn't really changing community health. Employers, when we talk to them, we say, they will say things like, we'd like to address, we'd like to engage, we'd like to be involved in what's happening in the community, and that's terrific. And then they say, what would you like us to do? And we're saying, we're not really sure. So I'm just asking if you can, in addition to changing core business, to the extent you can kind of get really granular and tactical and give examples of, beyond just donating to farmers markets or other not-for-profits, what are things that employers actually do in the community to get out there? So thanks.
Well, I can speak to sort of from a tactical perspective. We've had a couple of communities who we've run into those same conversations, right? Businesses say, yes, we want to do something. We know there's a problem. We don't just want to give money. We don't just want to have a one-time event. We want to think about, how can we really be part of a sustained solution? And so, in many cases, what we've done is actually create the path for that conversation to happen. So, for instance, there's a construction company up in Massachusetts who very intentionally chose to remain located in an area when a lot of other companies were moving that was a lower income area, that it was a lesser resource area, because they felt like that the area needed a presence there. And what they've historically done for the community was have, a this day or a that day, right? We'll have a day where we invite people in and do something. And what we started to talk about was, is there a way to identify sort of what the community sees are the challenges, kind of looking at somewhat like the Y model and saying, what do they identify as the places where they really need, rather than just say, hey, we're going to have turkey giveaways at Thanksgiving, which is lovely, but it's one day and it's not anything that's going to be so impactful, to really kind of survey the community and say, what do you think would make this community healthier? Where do you see the gaps and the need? And in some cases, it was, very similarly, we need opportunities for our kids. We need them to feel more engaged. We're concerned about them just hanging out and not doing things. So there were opportunities for mentoring and for connecting on that front that maybe weren't traditional health things, but were a means of kind of getting kids moving towards healthier behavior. Or, instead of the once a year thing, is there a walking or a running kind of regular model? We have employees, who exercise in the afternoon instead of at noon. Could that be in the neighborhood where youth were invited to do that with them on a regular basis so that there was some engagement there? Is there a way to open up any part of our facility, which is sitting here, for community meetings and community conversation that can lead to some of these solutions? So I think some of it is, it's not as pre-prescribed, and that can be kind of scary for people. It's like, oh, so we're just going to talk about and come up with an idea. But often our experience has been the community sometimes will come forward with somewhat specific needs that actually aren't that hard to address necessarily when they talk about it together, and then where you can kind of just be that middle point in convening and helping that move forward is one model for that sort of solution approach.
One thing I would add, that's a great question, and one thing I would add, and I'm actually going to come up to Rochester in a few months to talk about this, is that companies often are looking for what to do. Like, if we're to the point where the company is willing to get involved in the community, let's assume that battle's been won, they aren't really sure how to get engaged, and so a lot of times what we will see companies begin to do is engage with nonprofit hospitals and their CHNA requirements, right, which is what they did in Hagerstown with Healthy Washington County. So it is not the company coming in, and because for those of you that are unaware what CHNA requirements are, nonprofit hospitals keep their nonprofit status, have to choose 5 health issues in their community, and they have to actually work to improve those in their community, inside and outside the hospital 4 walls. The companies get involved, and they don't go in there and say, hey, do these 5 things, but they say, oh, so this is what the community is working on, right? This is what, like, we can hitch our efforts to a truck that's already moving, right? That's already has federally required metrics around it, already has and so if, and you have to do all 5. And what we've seen is I've seen a company, this is not in Hagerstown, I won't throw Paul and Co under the bus, but there was one community where we saw that, where there was, maternal health, and they're like, sure, that's something we can sort of help, get something around and maybe raise money for and help out. Food security, yep, definitely something we can do. And then they got to STI rates. And when we talked about that, and I said, well, you know, one of the things that's really bad in your community is that you have really high chlamydia rates. It was like I put it's like I put a bag of dog shit on the table, right? So you can't really expect companies, like every company, to like really gung ho and say, yeah, let's pass out condoms and make sure these kids aren't, you know, getting chlamydia in the clap. But you can sort of get involved in ways that are a little more, you know, that help more broadly by getting involved in that conversation voluntarily and not in sort of a controlling way.
So being the last panel of the day and really trying to say, how can we unite on that united front? As national organizations working...
Excuse me, I would like to ask questions.
Okay, I'll get to you. Just one moment, please. So as, you know, as the national organizations coming together, how can we have a unified effort or message amongst all the organizations on representing, instead of all AHA is doing this, BPC is doing this, what innovation strategies could we employ that would help bring about? And I know, Jessica, you wanted to also talk a little bit about collective impact versus collaboration, because right now I see we have collaboration, but I don't know that it's enough to move the needle. So I would love to get your ideas on how to move the needle, and then we'll get to the next question.
Well, to address it from that perspective, and I think, you know, there's a saying that I'm sure is somebody's that I'm not going to quote correctly at all, but, you know, imagine what could get done if nobody needed credit, right? This idea that so often I think we can find ourselves, just because of how the system works, in sort of this competitive space where we're sort of reinventing similar approaches and similar things because there's a sense of sort of, yeah, but I need it to be within my wheelhouse or my brand or my funder or my whatever. And so the more we can break down those barriers and work collaboratively, I think the better that is ultimately for the outcomes, because we're not confusing people, right? When we all come to the table with 3 different playbooks, but they all kind of say the same thing, then that can be very confusing. So I think just having those open lines of communication has been great. I think the collaboration versus collective leans to that concept, and the idea being, and I think there's a lot of examples of it locally, but it begs an interesting question if we were to try it on this more sort of holistic national scale. But that idea of, instead of saying, hey, I have a great idea and I'd like to do this, who's with me? Which I can end up in a collaborative situation where 5 or 6 people or organizations say, yes, we're in, let's go, this is great, but I've already kind of predetermined where I'm going, what the outcomes are, how we're going to measure it, how I define success, all that good stuff. So it's, you know, it's just exactly what I want. Whereas in a true collective, you know, we would come to the table with differing agendas and differing opinions, and we would work that out collaboratively to where we all agreed on what is the common agenda, how are we mutually defining success, what are the measures we're all going to hold ourselves accountable to, so that it isn't like, well, I'm good, we got what we wanted out of this, even though you didn't get what you wanted out of this, but we sort of win or lose, so to speak, together and collectively, and then there's really that sort of mutual ownership and mutual need, and it requires a lot of trust and a lot of communication, but it's a way of leveraging what we refer to as kind of mutually reinforcing activities. So if you have certain organizations that are really strong in advocacy, they can deliver on that, whereas others might be at education, and others may be able to bring greater financial resources to the table, and some may have great sort of CEO presence or, you know, other kind of bully pulpit opportunities that some don't have, and if you can leverage all of that to have that common faith, you know, we can achieve much greater things, and particularly if we maintain that equity lens and think who's not at the table and make sure that those voices that may not otherwise be heard are just as loud and have just as much power and presence. So I think that's sort of the vision, and that's certainly what we've tried to apply more and more in our community work. It's slower. It's harder to define metrics at the outset, so it can be uncomfortable. But I think it would be an interesting model to take that same concept with some of these issues and think, gosh, how could you work, you know, across collaborations, which many of us are involved in.
Yeah, I think, Jody, I think that's so right, Jessica, and I think that thing I would add in terms of sort of the united front, I don't know exactly what the message is, and this may seem basic, but I think the message for our organizations is that business has a role to play, and we can't really achieve change without them, and some organizations work proactively with business in a positive frame, some work in a different frame, and truth is there is a role for all of that as long as we're all sort of moving in the same direction.
Any other feedback? Okay, we'll go to the question in the audience.
No, thank you. My name is Li Yang. Thanks for your time and effort about these issues. But I'm thinking now, current system, we allow private sectors or business to contribute whatever they want, to volunteer whatever they want. The problem now is the system has a lot of problems, like private businesses or civic organizations. They try to victimize people, send them to jail, like mass incarceration. So if we, the PowerPoint there, if we think the health is a wealth or vice versa, wealth is a health, we must stop those people who send people to jail or to mental hospital or to behavior institutes. Because those are phony, those are victimized people, and we are reducing our productivities and our employment figures. So this is number one. Number two is currently PPP, public-private partnership. There's propaganda by some people who are basically involved or in serious fraud and crime in just network, especially official misconduct and abuse. If you think about this, we must ask those people who can stand up and target it and identify who is doing the wrong thing rather than cover it up.
Do you have a question for this panel on this?
Sure, my question is big, so if you can just tell me exactly why we should not privatize Social Security benefit, because Social Security benefit, so far as I know, a lot of people, they cannot get it. They cannot get it because government do not want to give it to them, or employees do not want to give it to them, or they just put the people in the wrong ID information. So if you would like to help, ask government to strengthen out all the people's ID information and have their people benefit, social benefit, whether it is a social benefit or Medicare, rather than to benefit people who are health provider. You send them to hospital after you brutalize them, after you send them to jail. It's unnecessary and it's just the opposite direction. So I just hope you can really work on this direction, and it's very easy to identify, especially if you have IT and knowledge. Currently, government will not allow people to have ID when they are smarter, overqualified.
Thank you. Thank you for sharing your feedback and your input.
So, maybe I can just sort of respond to one comment and then maybe segue. And I think some of the initial points seem to be related to, how do we maximize, how can businesses and employers maximize the output and impact of consumers, and how do we support consumers in the best way? And there are a lot of criminal justice practices and ban the box and a lot of things that employers can do to better support, I think, their employees. And so I think some of that might get at to some of the initial comments there. But if I could just sort of just pivot back to I think where Jessica was going, and there was also a question of what else can businesses do. And we talk a lot about sort of wellness, and there's an HR department in businesses. We talk a lot about corporate social responsibility, but I think this advocacy piece is a critical one, because at the end of the day, and from a policy perspective, that's where you can really maximize the impact in terms of improving health. And I think for businesses, for a lot of them, they may not all be comfortable in advocacy, and I think that's something we ought to talk about. Some are going to be uncomfortable, some are not. It could be issue dependent. But in our work at BPC in this latest report, one of the things we went into the report thinking, well, you have governmental public health here, and you have businesses here. How do you establish relationships to improve community health? We came out of the report realizing it's not sort of just 2 points. It's actually a triangle. And the third pillar is really elected officials. If you're really trying to move the needle on policy, and you need relationship building, not just between businesses and public health, but also elected officials. So it could very well be that what a business might do when tackling tobacco or substance abuse or nutrition or physical activity is not the usual worksite wellness, or not the usual corporate social responsibility. It could be getting up in front of the city council and advocating for a particular position. And I think that's going to be something that some businesses are going to be comfortable with and some are not, but something that we ought to talk about.
And likewise, on that same sort of, we talked a little bit more earlier today about the C-suite and the top-down approach, but yet we know that the C-suite leaders don't have the time that it takes to develop these relationships. Some of the C-suite leaders may sit on their local chamber of commerce, something like that. But how can do you have any thoughts on inside the corporate or the employer operation? Somebody else earlier suggested working with the CMO and the marketing and communications folks. HR has a role. How we can help them coordinate, because I know within the silos of business, they're not talking across. Do you have any thoughts or suggestions or ideas on that?
Okay, I'll keep it short as opposed to the rest of my comments. So I think there are two different tactics I think that folks can engage, and I'm speaking primarily of companies that have a C-suite. So we're sort of flooring them at a couple hundred employees. I think so. Keep in mind there are two divisions in general of companies that have more money now than they did 10 years ago. That's R&D and comms. So if you can get to them, you're better off, right? So think about that if you have a way to leverage one of those two groups. The other way is there's been a massive growth of what are generally called employee resource groups. And if you can find a way to work with them, because they usually have a way to circumvent a lot of the bureaucracy that might, harm in you getting something sort of done. You might get lucky and find an ERG that has a C-suite person on it. And if you can find one that is about, lifestyles or things like that, you can generally help accelerate in that sense if you're looking for ways to game the system, so to speak.
I was just going to say, I think for us, where we've found C-suite being receptive to our message and our desire to encourage change is really about the business case. We've said that many times today before, but the more data we can show that the market is moving towards healthier options, consumers are demanding it, that's where the growth is, the more open they are to talking with us. I think it was maybe Stephanie earlier today that just talked about how important buy-in is at the C-suite level, and I don't think we could emphasize that enough. We do find there are CEOs out there who are willing to take more of a calculated risk when they have a real personal passion, when they feel as if this is the right thing to do, and they're not going to do something that's going to lose money, but they're willing to maybe put their toe out there on something that maybe hasn't been proven yet.
Bob, you've been waiting patiently.
Not so patiently, but I don't think this is on. Is it on? So we haven't really talked very much about how work is changing and kind of not only the demographics in terms of the number of generations, but how people aren't employed. Less and less are they actually employees, oftentimes contractors, or they're in and out of employers, through revolving doors. I wonder what your thoughts are in terms of how is that going to impact the way employers think about investing either in their own workforce or in the community per se. Is it going to stimulate either on the employer's perspective more concern about the community because they're exposed to more of the community, whether they're contracted or not, or is it going to be suppressing that? And what is kind of society's reaction, really from a policy or a political perspective, to that tendency to disemploy people and therefore throw onto society in general kind of the responsibilities of welfare?
That's a great question, and I know you're referring primarily to 1099s and folks, but let me talk about the two things that keep me up at night that are related to what you're talking about. One of them is that the machines are taking over, right? The technology is going to remove a lot of jobs of people that are the ones who probably need this help more because of the type of work they do. And what concerns me is that not that machines are going to take over our jobs and we'll get UBI and sit on the beach, that's great. What concerns me is that's going to be uneven. That some industries are going to be able to replace their employees quicker than others. Hence is there anyone in here from McDonald's? I want to do Roy Rogers because of Paul. But the McDonald's near my house is all robots out front. Used to have 10, 12 employees in there, now it's got 3. You know, those are 9 people that probably could have used, you know, healthy programming of some sort. And if it happens unevenly, that means that the companies are going to have less, some companies are going to be able to care less economically, not necessarily for something they care about their communities, because it's going to be less important. The other thing that keeps me up at night, I had a hypothesis when I walked in here this morning that I thought to myself, I'm not going to hear any program or initiative or anything that happened before 2008. And I haven't. Because that was when the recession hit, right? All of the work we're talking about, it's roughly 10 years old or less, right? And the recession's coming, guys, right? And you're talking about sort of temporary individual folks going back and forth. What happens when the job numbers we're hearing are wrong? And they are. Like, what happens when that comes home to roost? Right? Is that going to have, like, are our programs that we're talking about, locally, nationally, around the country, can they survive an 18-month recession? Now, I'm a little optimistic about that because of all the stuff we've been talking about on these boards, right? That we're changing the description about, like, you just got to care about people's health. It's awesome, you know, which is fine, to, like, there is a case for it, right? And you're going to have healthier employees for it when it happens. And I think we need to make sure when we communicate this to employers, that we're communicating it both when the rising tide is lifting all boats or not, to when that tide is dropping and dropping all boats. I think we have to be able to talk about that in both ways. That's what sort of gets me. I mean, and I understand not to sort of walk over your 1099 question, but I think we might have broader structural issues that might come to bear sooner with larger impact.
Deep thoughts by Lois. And I think likewise the changing landscape is also with government, and business has an opportunity that they may have never had before to really take the leadership in some of this work. I know Partnership for Healthier America, Nancy was talking a lot about, this is unprecedented, like the actual opportunity for business to be a leader and to dictate how this all works going forward. So coupled with the fear of a recession, I can see meeting of the minds coming both ways. But so any final thoughts after we've had this discussion, and some of you have participated throughout the day and have heard some of the conversations? Do we have any final thoughts, or what's your glimmer of hope that you want to leave?
We'll try to glimmer. Yes, good. We'll let Lauren see the ultimate glimmer. I would say, I think, to your last point, we are seeing more and more authentic interest in both the health of employees and the health of communities broadly, and the health of society, and the health internationally, as all those lines have gotten a lot fuzzier. And also as the emerging, sort of the next generation of employees are pretty demanding when it comes to cause and, you know, and all the different things that they sort of want the world to be, and some of the social constructs that may have driven previous generations in terms of what you do and do not say to an employer, do and do not demand from an employer, you know, are sort of going away. And now there's just this expectation of, like, well, that's great that you'd like to hire me, but, you know, what are you doing for me? And what are you doing for my community? And what are you doing for, you know, the environment? And then we'll talk, right? So there's a push to that I think we're seeing play out in a lot of authentic engagement, both on sort of the systems front and the positive, not just kind of incidental programmatic pieces, but more kind of structural change. And to your point about sort of core business and really thinking about what role do they play. So I think there's a lot of optimism to be found there, and some of it is just harnessing and focusing and figuring out how we work together. And then, you know, as some scientists in the room, how we continue to evaluate so as to drive towards best outcomes and evidence when resources are more scarce and when things are kind of moving in a different direction and we're having to make a lot more tough decisions about what's happening, and we make sure that we're making those that are really driven by what might be most effective and not just kind of people's, you know, gut reactions or anecdotes along the way.
One thing I want to encourage everyone in the room when they're talking about making this connection between health and wealth, right? We all, particularly for those of us in the room, more trained than I am in the social sciences about, making that connection deliberately for individuals, it's tough, right? There are so many external circumstances that impact someone's wealth or income, and they look really correlated, but are they time series correlated, blah, blah, blah. I'm preaching the choir, right? That stuff is kind of hard to prove. What's easier to look at, and what might be a stronger thing for businesses, if you look at business economic health. So don't look at household income, don't look at anything that has to do with individuals. Look at business growth. If you look at over the past 10 years, and you take let's look at the obesity rate as a independent variable, and you look at that, and you find that over the past 10 years, per county, the average increase in obesity is 5.7 percentage points. If you look at the counties that had less than that, so the healthier counties overall, those are the places that had much stronger business growth, more employees per establishment, higher payroll per establishment, controlled for everything else than the counties that were over 5.7%. And so when you're talking, that might not be as important for large companies. When you talk to small companies, and you're talking to them, you're like, this is like, the people in this place are healthier, but people like you, your organizations like you, do better when health is increasing. That is, I think, a strong argument, and one that I think will survive and perhaps be an important arrow in the quiver when the next recession hits. So.
Yeah, I would say that I think there just continues to be momentum, but that change is hard and it takes time, and we have to celebrate the incremental success. I think companies are thinking of community more broadly. I think they're thinking about customers and employees too, and I think customers and employees are really demanding that they change, and I think that they're starting to do so. And it is pretty amazing to watch companies make voluntary changes that don't require government regulation. Not to say we don't need that too, because we need it all, but I do think change is possible even without that.
I would end by saying I think every business in America, large or small, has a sweet spot for which it makes sense to engage in community health. And we need to help those businesses figure out what that sweet spot is. And for every business, the tactic may be different, the partners may be different, the issue may be different, but I would really challenge all of us who think about health on a daily basis. How do we help individual businesses figure out what that sweet spot is? Because I do agree that it exists, and whatever we can do, again, to catalyze some of the great work that's ongoing, we ought to be able to share those lessons learned as best practices.
Well, thank you all for your time and sharing your thoughts and perceptions today. I'm going to turn it over to Bob McClellan for the concluding remarks of our day, and thank you all for attending.
Well, I'm curious, just as we're all about to leave, just by a show of hands, how many people feel as though in this last year there actually has been momentum compared to where we were last year? So certainly the majority. Today was a terrific day. Certainly I enjoyed it a great deal. I've been to few conferences in such a small room with so many speakers. So we had the advantage of today hearing so many different perspectives on a topic. Thank you to all of the speakers, the moderators, and of course a special thanks to the National Academies in general for the room, and to the staff, Alina Bachu in the back, and Leslie Tim, is she still here in the back? Yeah, and Cypress Links and Brittany Davenport, Carla Alvarado helped put this meeting together. There were a lot of planning meetings for sure over the past several months. We had about 50 people here today, which was a really good showing, and about 35 or so participated by web. And so most importantly, of course, is what happens after we all leave. So we do have follow-up planned. You will as registrants be receiving a package by email. I think we have everyone's email, which will include the collated minutes from today, as well as links to important resources that have been mentioned throughout the day, and importantly, links to our different collaboratives, as well as, I hope, Alina, your email, so that for people who have follow-up thoughts and contributions, please send them to Alina. But on behalf of both the Obesity and the Business Engagement Collaborative, thank you so much for attending today, and we'll keep in touch. Do good work.